Chapter 5, Middle Childhood Physical Development. Section outline. So in this section, we're going to discuss the overview of physical development, the physical milestones in middle childhood, physical growth, motor development, and health issues. Overview of physical development. Physical development is the physical growth from birth to adulthood, the development of both gross and fine motor skills, and the progress of one's control of the body. Let's look at some of the milestones in middle childhood. So, motor skills during this time, so ages 5 to 11, 5 to 6-year-olds can run, gallop, jump, hop, skip, throw, catch, strike, and kick. And a lot of the opportunities that they need are activities that focus on fun and developing motor skills rather than on competition. Simple activities, because they still need very clear directions and guidelines, and repetitive actions that do not require complex motor and cognitive skills like running, swimming, tumbling. They're not quite ready for that. Ages 7 to 9, they're learning fundamentals. They're transitional, so they're learning how to throw from distance and throwing for accuracy instead of just throwing. So activities that they need are things that focus on developing the skills, again, rather than competition. Activities with flexible rules that require little instruction and do not require complex motor and cognitive skills. So entry level baseball and soccer and basketball, they're still learning the foundations. Ages 10 to 11, they're transitional and complex. So now they're able to play full games of basketball, soccer, and other sports. So again, they're still focusing on fun and developing motor skills rather than competition. Entry-level complex motor and cognitive skills and activities that emphasize motor development so that they can practice and begin to incorporate instruction on strategy and working as a team now that they have the foundations. So physical development in middle childhood. So height and weight changes. Growth in middle childhood is less dramatic than the other age ranges, and pre-pubertal growth spurts are occurring. So this is a rapid increase in height and weight preceding puberty. Girls during this age are typically taller and heavier than boys, and especially towards the end of middle childhood. And this is primarily because girls typically mature quicker than boys. So girls typically go through puberty around ages in between this 12 and 13 mark, whereas boys it's more around 13, 14, 15. So bone growth. Bone development is slow during this time. And to see more about how bones grow and to actually see what this looks like, there's a video that I'm going to share with you. And then bones grow at their tips and ends. And this is the reasoning for vertical height changes. Bones also grow at their outmost edge, and this is the reasoning for the width changes that are occurring in the body. And the soft cartilage is replaced by hard bone during this time. So they're really growing into their adult stature, but it's going to continue into adolescence as their bones are continuing to hard. And most bone development during this time is in the later part of middle childhood because they're still growing towards that and going into adolescence and continuing. And then bone development is also related to nutrition, and physical activity and equipment could endanger the bone development. And especially during this period of time where they're starting to get into sports and activities. So making sure that they have properly fitting equipment and shoes, being aware of the dangers of point shoes and things like that in regard to bone growth. So fat composition. So as the bones continue to grow, there is a general slimming of the body for both girls and boys. Girls are typically taller and heavier than boys, and towards the end of middle childhood, especially towards the end of middle childhood. And as you can tell from the pictures, looking from kindergarten up to 6th grade for middle childhood, you can see how slimming and the body composition has changed as height and width have occurred. So muscle growth. Children at this age participate in more strenuous activities for longer durations, and this is associated with muscle development. So, to see more about how muscles grow, I'm going to share a link with you about that. Now, if muscles at this age are overused, there may be damage. Something that's quite common is what is known as little league elbow, and this is where they have repeated stress from throwing. And a common complaint about it is muscle aches and pain around the joints, and it could cause them to not be able to continue through the sport. Now, physical fitness does have many benefits. Social opportunities is one of the biggest ones. It does stimulate growth, academic performance, and contributes to health self concept. So, teeth during this time. So, shedding of teeth is something that does happen during this age. So, when they were in infancy, they were growing their 16 primary teeth, and now they're lost, and their 28 permanent teeth are now erupting and replacing those baby teeth. Now, the first permanent teeth erupt around 6 to 7 years, and molars are the first ones to erupt. Molars do not replace those deciduous teeth, but signal that the others are about to start shedding and being replaced. And the third set of molars are what are known as the wisdom teeth, and those do not appear until adolescence or early adulthood. Now, most children do have their full set of permanent teeth by the end of middle childhood. Some children have to have dental intervention to remove some teeth as they continue to grow and develop. Folklore of the tooth fairy does oftentimes help children cope with the fears and anxiety. And losing teeth can also be seen as a status symbol as maturing and getting older. But as we grow and develop and get older, we realize that it may have been more of a painful nuisance than it was a status symbol. But at that time, it was showing that we were growing and getting older. So we're going to pause and we're going to process what we have just covered so far. So go back and review as needed to address these questions. So motor development. Motor development deals with the fine and gross motor skills. So during this time, bilateral coordination continues to improve. So in early childhood, they were learning a lot of the foundations of using both sides of the body to complete tasks. Now it's becoming more coordinated and more fluid. So they're able to write and use a ruler and throw a ball and catch. They're able to do all these different things. Now, some children still have some trouble and they may need some OT or PT, so occupational therapy or physical therapy interventions to help them with this as well. So, motor skill development during this time, muscle ability, coordination, and performance improve significantly. And this is primarily due because it's the slowing of the growth. So now they're fine tuning and advancing the motor skills in regard to the size of their body. So motor skill improvements that happen are strength, which is the ability to exert force, flexibility, the freedom to bend or move the body in various directions, impulsion, which is the rate of the body movement begins from a stationary position, speed, the rate of movement once the body is in action, precision, dexterity and accuracy, coordination, the ability to use different muscle groups together, balance, the ability to maintain equilibrium and stability, and then rhythm, regular body movements. So during this time, there's a lot of things that are happening physically in regard to their motor skills, but it's really that refinement process of them getting better, getting stronger and flexible and speed and precision and really honing in on those skills. So sports and development. Sports are structured activities that have certain rules. And most sports provide an opportunity to learn both skill and life skills. So sports skills and life skills. And it can help promote healthy development in children and adolescents. Even with all those great benefits, there are some negative outcomes. So stress to perform well, injuries, burnout, and delinquency are all possibilities when it comes to playing sports. It all depends on the balance between sports and academics and their own time to explore other things that they're interested in. So there's 5 C's of optimal physical development, and sports can really help develop these through skill development, mentorship, modeling, and good sportsmanship, and belonging to a team. So competence is the first one, and that's an individual skill or ability and proficiency within a certain domain or a certain sport. Confidence is having the certainty in one's ability. Connections, their relationships with others and feelings as if they belong. Character, having a moral compass and integrity. And then caring, having empathy and concern for others. So there's lots of things that really need to be a part of them in regard to optimal development. So they have to feel competent, and they have to be confident, and have to have connections with their teams, or they're not going to be able to participate as much as they could, and some of those negative outcomes could happen. So we're again going to pause and process what we have covered so far. So health issues. Nutritional needs is always a concern across all age ranges. So making sure that eating habits and appetites, they do improve during this age because they're more physically active. However, obesity is still an issue when it comes to children that aren't as active or participating in any type of activity. So food intake does increase, and television can also influence food choices, especially products and commercials of unhealthy eating and products that are aimed at children, such as certain yogurts and fast food. All of those are aimed towards certain populations and age groups. So for 6 and 12-year-olds, looking at the portions, so when we looked at early childhood, we saw a much smaller portion of the mac and cheese and the chicken nuggets and the vegetables. So vegetables is still the biggest part, but the carbs have increased and the amount of nuggets have also increased. Portion sizes also are down here at the bottom to kind of show what is better in regard to how much is too much. So understanding illness has also changed during this time. So during early childhood, they were in the first 2 stages of understanding illness. So they understood illness as a concrete phenomenon that was removed from the condition, and they understood contagion, so caused by people and objects, but not by touching. In middle childhood, they move into the 3rd and 4th stages, though, which is contamination and internalization. So contamination, this deals with the touching aspect that they did not have in early childhood. So contamination, they understand illness as caused by people, objects, or actions that are external, and it's transmitted through touch, contact, and harmful action. So sneezing on someone or not washing your hands becomes more knowledge based in middle childhood than younger kids. Now, internalization, this is understanding that actions such as breathing in a virus or ingesting food with salmonella can lead to an illness. So there's other things that can cause as well. So physical illness and accidents. So school-age children are typically better health than preschoolers. They typically enjoy better health. So common illnesses are still colds and respiratory infections and infections due to not being vaccinated. So flu is a big one and things like that. So accidents also continue to be the leading cause of death for this age group, primarily because of injury due to lack of supervision, not wearing proper gear because they deem it uncool to wear helmets and things, not using the equipment properly, which is very common in middle childhood, climbing the slide, being on top of it instead of using it properly and falling, and then lack of judgment. They still think that they're invincible to a point like they did in early childhood, but they're a little bit more weary of depending on their experiences with getting hurt or seeing others get hurt. So mental health is one thing that does become a little bit more prominent in middle childhood. Now, some children, it is observed and documented or diagnosed in early, but a lot of it does start to come out in middle as they start going into school and they're interacting with people and teachers and other caregivers, and a lot more starts to surface and people start becoming more aware of it. So things like anxiety disorders, autism, depression, ADD and ADHD, schizophrenia, conduct disorder, and oppositional defiance disorder. And we're going to talk about these in just a second. So, anxiety disorders, this is when children do not outgrow the fears and the worries that are typical in young children. So, their worries really interfere with their ability to do other things. And these could be things like being afraid when parents are away, separation anxiety, having extreme fear about objects such as dogs, insects, going to the doctor, phobias, needles, being very afraid of school, so social anxiety, being worried about the future and about bad things happening, and then having repeated episodes of sudden unexpected fear that comes with heart pounding, panic disorder. And children show these anxiety disorders in different ways. So, anger, not being able to sleep, defiance, lack of focus, negativity, over planning. There's lots of things that can be a red flag that something's not quite right and they need some assistance. So, autism, we've talked about this before, but this is really dealing with social interactions, not being able to adapt to different social situations, not being able to understand verbal and nonverbal cues, being distracted, lack of speech, not being able to relate to others. And this can cause a lot of issues in middle childhood when it comes to adapting to peers and being able to focus in a classroom setting. But a lot of interventions are in place, such as not using fluorescent lights, noise canceling headphones as needed, making sure that the child's aware of any changes throughout the day, and other things like that. So, depression is feeling sad or uninterested in things that used to be enjoyed, and feeling helpless or hopeless in situations that they are able to change themselves. So, some examples of this that are seen in children are feeling sad, hopeless, and irritable a lot, not wanting to do things that they liked, showing changes in eating. So, they may eat a lot or they may not eat. Same thing with sleep, either sleeping more or not sleeping enough. Changes in their energy, so they're tired or sluggish because they're not getting enough sleep, but maybe not enough calories. Having a hard time paying attention, feeling worthless, useless, or guilty, and then self injury and self destructive behavior as well. And extreme depression can lead to a child to think about suicide or plan for suicide. And this can be for a lot of different reasons. It could be their academic performance, it could be not having friends at school, it could be um, parenting styles having an issue and them just feeling like they don't know what to do. So, ADD and ADHD, we've talked about this before as well, is a disorder that causes children to be either highly distractible, which is ADD, or highly distractible and energetic, ADHD. And again, at this age, this is when a lot more of this starts to get diagnosed. And we talked about impulsivity and them being able to focus on attention, not being until they're about age 10. So a lot of these ADD and ADHD diagnoses really start happening in middle childhood going into adolescence, because this is where the brain is now able to regulate and focus attention. And again, these are oftentimes diagnosed and prescribed a psychotropic medication and also interventions with special education or 504 plans and IEPs to help them stay on task and help them manage their attention, impulsivity, and hyperactivity. So, schizophrenia is a mental illness that causes people to interpret reality abnormally. And it ranges, it's cognitive, emotional, and behavioral problems that impair their ability to function. So, symptoms of this are things like hallucinations, So seeing and hearing things that aren't actually there, delusions, false ideas um, that are believed by individuals, but by the individual, but not by other people. They have disorganized thinking, so evidence of derailed or incoherent speech. They can't get their thoughts out. They may have a flat effect where they're monotone and they don't have a lot of facial expressions and they appear as like like there's nothing there, like you're not quite sure how to read their emotions. And then they also have a paucity of speech and thought. And this is when they're prompted, but they give you really, really short answers. And then bizarre behavior where they're inappropriate, they're disorganized, odd behavior, inappropriate for that age range. So they may have a temper tantrum or they may lash out in a certain way that a younger child would than someone their age. Now, schizophrenia is caused by many things. Genetic factors is one thing. So if it is in their genetic makeup, more likely to happen. And then environmental factors as well. So complications, genetics, prenatal famine, infections. There's a lot of things that can cause this, but it is a combination between a couple things. So, conduct disorder is an ongoing pattern of aggression towards others and serious violations of rules and the norms. So, these rule violations may involve breaking the law and result in arrest. And children with conduct disorders are more likely to get injured and may have difficulty getting along with their peers because they get in trouble a lot. So, examples of this would be breaking serious rules such as running away, staying out at night when not told to, or skipping school, being aggressive, so bullying, fighting, and being cruel to animals, and then lying, stealing, and damaging other people's property on purpose. So, oppositional defiance disorder, known as ODD, is a conduct disorder that is characterized by a pattern of disobedience, hostility, and defiant behavior. It is a little similar to conduct disorder. Conduct disorder is kind of a broader diagnosis, and then this is like a classification off of it. So, examples of this would be being angry or losing one's temper easily, arguing with adults or refusing to comply with rules and requests, being resentful or spiteful, deliberately annoying, and blaming others for mistakes. Now, the cause is unknown and often treated with therapy and parent training. So it's a lot of talking and helping them to regulate and reflect upon their actions. But if untreated, then it can go back to the broader umbrella of major rule violations, breaking the law, and resulting in arrest and harming others in a more serious manner. So, promoting wellness. Parental monitoring is one of the most important things during middle childhood and any age, really, knowing what's going on. So, adult supervision, so making sure that children are using proper equipment. So, making sure that children that are ages 2 and 5 and 5 and 12 play separately because the equipment's different and their bodies and their development are way different. And 2 and 5 year olds are going to follow what the older kids are doing and they may not be capable. And then the older kids may forget that the other kids are little. So enforcing safety rules, so no pushing, shoving, or crowding, and then making sure that the clothing that they're wearing is appropriate so that they don't get caught on anything, which could choke them. Also making sure that the play environment and equipment is safe. So it's maintained and in good working order, so no more metal slides that burn, equipment that's anchored to the ground, and making sure that there's soft surfaces for them to land on, and then making sure that their safety gear fits properly. So a couple other things are falls. That's one of the major things. So making sure that there's lots of proactive measures. Poisoning, making sure that they're keeping things up and away so that children aren't getting into it, knowing how to contact poison control and things like that. And then motor vehicles is probably one of the biggest um, hazards towards children, especially with them running out in the street and getting hit or not being in the proper safety equipment, safety seat, being to not wearing their seatbelt and things like that. So, nutrition and exercise, it is really important for them to be active at least 3 times a week and at least for 60 minutes. Now, that doesn't mean they have to be out there for one giant 60-minute period. It could be smaller little things in between. But it has a lot of positive benefits for them to do, as well as social, emotional, cognitively, developing those motor skills, all of those. Now, food pyramids, I know a lot of us have seen these before, and it's changed a lot since it was first developed. And there's a lot of different types of food and nutrition out there today. But today, most of them are very, very heavy on fruits and vegetables and proteins, and making sure that the other things, such as um, carbs and grains and fats, are as minimal as they can so that everybody's getting the nutrition that they need, the vitamins, the minerals, and everything they need to have a healthy body and function. So, promoting wellness and medical care is still just as important as it was in early childhood as it is now in middle. So, making sure that they're going to the dentist and getting their checkups on time. And during this age, it's really once a year, and dental is twice a year, so once every 6 months. And then eye exams pretty much once every year. And a lot of schools have that in place so that they'll do vision tests, and then if anything's up, you would take them to their eye doctor. And then making sure that they have their immunization so that they're not susceptible to any type of life-threatening illness. So we are going to pause and process what we have covered so far, so go back and review as needed to address these questions.